jump to another patient. I have a 68-year-old who's on dialysis who returns to the dialysis unit following palliative surgery, and he understands that term, to remove a recurrent anorectal cancer with a poor prognosis. 6 months ago, prior to the initial diagnosis, he was working towards transplantation with his son. I've heard you use two statements before, the different place now or I wish statement. How might you use those two statements, and why would you use those statements in this situation?
Sure. So we are in a different place. I mean, he was being worked up as a candidate for a transplant, but now it sounds like he has at least stage 3 cancer. And you and I both know that you're not a candidate for transplant unless your cancer's been in remission. Most centers say for 5 years, at least 2 years. So he is not in a, and it sounds like it was, they couldn't get the margins
right.
clean.
They just said we're going to debulk it, and but
yeah.
you know that this will progress, and
yeah.
so go ahead.
So I'm going to use the same approach that I used in the previous patient. I'm going to ask him, what did the surgeon tell you about your surgery? Did he say he got it all? And so hopefully the surgeon did tell him, I didn't get it all, I got most of it. And then we would need to say, well, what is your understanding of the fact that he didn't get it all? And hopefully you may have to help him understand he still has cancer, okay, and that it's not curable.
And assuming, good, and then assuming he understands that he has a progressive cancer that's going to get worse, and he's, obviously worried about what lays ahead. For instance, you would start the conversation saying, well, obviously 6 months ago, we were in a different place. We were hoping for transplant and looking forward to a long life, with, ahead with good quality of life. But now we're faced with life on dialysis. And at that point, if he emotes, is there a role, if he expresses himself, is there a role for this I wish statement, to help him? How does that I wish statement play a role, and what's the significance?
Yeah, the I wish statement is a way of really showing some empathy, that you really care for the patient. And you can say, I wish things were different. I wish the surgeon had been able to get all the cancer. I wish your cancer was in check, or I wish you had been able to be cured from your cancer. But I worry that since your cancer isn't under control, over time, things are going to get worse. And the way we can help is to talk about what you would and wouldn't want done, so that at least we can respect your wishes. So you do try and turn a negative into a positive, but it's a different positive maybe than he was hoping for.